Hello, my name is Jason Halford, and I'm delighted to contribute to this ongoing work from the University of Leeds and its collaborators. Sorry I won't be there in person on the 9th, but I'm very much looking forward to the outcomes of this. Now, with regard to my focus and what I'd like to highlight to the group is the role of household food insecurity in terms of child health and inequalities in health, certainly in the UK. The UK has one of the highest levels of household insecurity in Western Europe, as far as we're aware, and it's particularly families in some of the most deprived regions of the north of England who suffer from this disproportionately. Now, when we're talking about health inequalities and families, we think of pregnancy, early childhood, and then obviously moving into the school years. And as somebody who works in an obesity and nutrition background, what we know is pre-pregnancy, during pregnancy, and early feeding practices, maternal diet and weight have been very important in influencing children's food preferences and their growth trajectories through both biological and behavioural mechanisms, exposure and learning. However, food insecurity throughout the life of a child, blighting families, has an impact. Food insecurity is living without reliable access to sufficient quality of affordable, nutritious and safe and, importantly, acceptable food. And this is a critical issue for families in the north of England. And we know that households with children in many of our urban, peri-urban, even our rural settings are suffering around issues of food insecurity and the affordability of food, need greater free school meal provision, and also are blighted by holiday hunger. Many of these communities now actually face what we call the triple burden, and the triple burden is overweight and obesity, undernutrition and micronutrient deficiencies happening within the same communities, leaving children vulnerable to both health and social inequalities with potential lifelong consequences. These inequalities, while being dietary based, relate to many other factors, and they contribute to inequalities in children's cognitive development, including language and higher order cognitive abilities such as attention, inhibition and memory. Poorer cognitive development, these children start early years education at a disadvantage, and those disadvantages tend to widen as they progress through the school system. And they are at more risk of learning difficulties, and that further exacerbates these inequalities as well. So although I start from a nutrition and a food insecurity and obesity basis, I'd like to see something, what I would say, joined up in terms of how we approach this. So thank you for your attention and have a good meeting. Bye-bye.